can stop right in the middle because it's gonna die. Or it's gonna,
Don't say that.
the memory card's gonna be.
No, I bought new memory cards.
Oh, you did?
Yeah, I bought 2
Okay.
new memory cards, so it should be okay. Okay, so the last thing that we're going to talk about is reassessment. But before we get to reassessment, we need to talk about interventions. What are interventions?
The things that we're going to do to the patient to interrupt the beta
What's-
process.
Okay, interventions are the things we're going to do to try and help. Why do we need to talk about that before we get to reassessment?
Because you're going to do these things and then you're going to reassess to see whether or not they've helped.
You're going to do these things and then you're going to reassess to see whether or not they helped. Interventions can be any number of things. It can be splinting a sprained ankle. It can be providing oral glucose to a patient who's suffering from hypoglycemia. It can be giving nitroglycerin to a patient who's suffering from a cardiac event. Okay, any of those are interventions. So anything that we're going to do to help our patient is considered an intervention. Oxygen administration is an intervention. Backboarding is an intervention. Any of the things that we can do to try and help our patient is an intervention. And we need to know what interventions we're going to use for what patients, because you're the one that's making the decision about whether or not the intervention is appropriate, based on your protocols and your standing written orders from your medical director. Okay? When we get to reassessment, what is reassessment?
Going over everything that you did.
Checking everything again?
Yeah. And seeing if there's changes.
Yep. Okay, a reassessment is checking everything again to see if there are changes. Why is this important?
Like the vital signs could change.
If their vital signs change, what does that tell you about your patient?
Well, it depends on if they change for better or worse.
Depends on if they change for better or for worse. But what they do tell you is that something is happening to your patient. Okay? They tell you, if your vital signs change, they'll tell you whether or not your intervention was an appropriate intervention or not. How often are we going to check everything again?
In a stable patient, every 15 minutes. In an unstable patient, every 5. Allowing for time, because you may be treating other life-threatening things.
Okay, in a stable patient, we are going to reassess them every 15 minutes. In an unstable patient, we're going to reassess them every 5 minutes. What makes the difference between, what makes you think a patient is stable versus unstable?
Steady heart.
Steady heart rate? What else?
If they're conscious, or
If they're conscious. If we have a patient that we did a focused assessment on and we have provided an intervention, we've splinted their broken leg, is that patient stable?
should be.
They should be,
If you do it
right?
yeah.
They should be pretty stable. So if you're talking to them and you reassess that leg every 15 minutes, make sure you've got a pulse, right? We're going to check pulse, motor, and sensory. Make sure you've got a pulse then, and you do that every 15 minutes. Guess what? You're doing your job. Your patient is conscious, alert, talking to you. They're stable. How do you decide if a patient is unstable?
Unconscious.
If they're unconscious, they're definitely unstable. What else?
Or if they go from conscious to altered.
If they go from conscious to altered or from altered to
Altered.
unconscious?
So
Are
change
they
in
unstable?
Consciousness.
A change in consciousness, yeah.
If alcohol's involved.
If alcohol is involved, that could make a difference between whether or not they're stable or unstable. If a patient deteriorates is they go from conscious to altered or from altered to unconscious. If they deteriorate, you have to go back to your primary assessment and start over. Why do we start over?
You might have missed something.
You might have missed something, and we have to deal with their life threats first. Okay, that's our job, is to deal with their life threats first. So if our patient deteriorates, they get worse, we have to go back and see what we missed, and this is where that process starts. Okay? Okay. Questions about patient assessment and management? Questions about Chapter 9? All right, let's go ahead and press stop. The assessment is super, super short.